All right. I think we did it. We're live.
We are live. Hello, everyone. Or maybe there's no one here at the moment, but you'll be able to see this later. I have no idea how this works. We'll figure it out as we go. But I wanted to welcome everyone first and just let you know what we're doing here. We are looking to field questions and answer questions on this live. This will be posted to our platform later, and also we'll send it out in our newsletter. But we did reach out to our social media platforms and ask people to enter some questions. So we do have some questions to start with. Should we just dive right into it?
Sure. I think we'll just mention that we just kind of talked about doing something like this, just very informally, kind of like a chit chat between you and I, fielding questions, fielding comments from anybody who's watching and interested in asking anything. Hopefully, just keep this really easy peasy, fun, and conversational, just kind of like our podcast. So, all right, Abby, what are we starting with?
All right. And just a little disclaimer, this is not treatment advice. This is not diagnostic in nature. This is truly just to inform our audience of some topics that we're super passionate about. So, first question. The first question is, I'm having 3 a.m. wake ups to go to the bathroom, and they are hard. I feel unsteady walking around in the dark, and that stresses me out. And of course, the stress makes it harder to then fall back asleep. What are some tips?
I have one that is actually something that I utilize, mostly because my eyesight is awful in the dark. And your eyesight is actually one of your strongest balance systems, right? Your visual system, the somatosensory system, and your inner ear. So if we can't see well and we have an impairment with our vestibular system, or we have neuropathy or something, going and walking around the dark is really, really tough. So my husband actually found this for me because he was getting tired of hearing me stub my toes and fall over stuff in the middle of the night. I will actually copy and paste that link into the comments. But they are LED lights they're like double-sided tape, and you just tape them around the bottom of your bed. And it has a motion sensor. So we put the motion sensor by the leg of the side of the bed where I am. So my feet come off the bed and hit the floor, the lights will light up, and you can set them to a bunch of different settings. So you can set them to different types of colors. You can set a timer on it. So like we have it set at a really low, like white glow or blue glow that lasts only about 2 minutes. So it's enough for me to get out of bed, find my way to the bathroom easily, and find my way back without having too much of an issue. So I'm going to copy and paste that link to that on Amazon just because it's a product that I really love, and I use it every single night.
I love that. And, Danny and her husband are literally famous for gadgets like this. So it makes sense that she would know about this, but also a little nightlight can help, and understanding what situations are most provoking to your symptoms. So like Danny mentioned, you have various systems that contribute to your balance. And when one system, AKA your vision, is removed because it's a dimly lit environment, your balance can become a challenge. Now, the second part of that question about falling back asleep, this is more personal, but one thing that I have found tremendously helpful in my experience with sleep struggles, especially waking up and then trying to go back to sleep, are sleep meditations. And if you look on Apple Podcasts or on YouTube, there are so many available. One of the ones that I've been listening to recently, I believe it's called Sleep Magic. And I couldn't even tell you what the meditation includes because I fall asleep and I forget. It's like truly sleep magic. So I think that would be one of my recommendations, especially, well, to go to sleep first, but also to go back to sleep if you do awake.
Mm-hmm. So other things, if you have BPPV, right? Everybody has different types of vestibular dysfunction or balance issues, but if you have active BPPV and you're getting dizziness every time you get up out of bed, a word of advice is when you get up out of bed, wait. Do not just jump up out of bed and make your way to the bathroom. Wait at least 30 seconds to a minute on the side of the bed to make sure, if you're going to have a little bit of dizziness with changes in position, that it doesn't happen to you when you're walking halfway across your bedroom. The last thing you need to do is have that latency in symptoms, get up, be halfway across the room, get a vertigo attack, and end up on the floor, or worse, when you're in the bathroom where the surface is probably even harder on tile. We don't need that. We don't want that. So make sure that you are aware of your symptoms when they might come on, and just being careful about that when you're getting up out of bed. Um, what else, Abby? Anything else in terms of?
Well, while we're on the topic of sleep, I think sleep hygiene is really important to talk about for vestibular disorders in general, in particular with migraine, with 3PD, with
Mhm.
MDDS. Going to bed when you're tired and having a wind down routine, I think, can be super helpful. It may include that meditation that we just talked about, but then waking up at the same time consistently is really, really important. Someone is calling me. Um, and I have found that that has worked tremendously in my life, even on the weekends when I want to sleep in. Sometimes I am up without fail at 6 a.m., which again, it's just setting that circadian rhythm. It's getting your body into routine. Your brain loves consistency and predictability. So implementing that small change can make a big difference in how you're able to manage your symptoms.
Especially for our migraine patients. There are some things, a lot of things in migraine that we can't control symptom wise or trigger wise. And we got to lean into the things that we can control. And good sleep and regular sleep is very important for migraine health and helping reduce potential triggers. So, going to bed at the same time, waking up at the same time, like Abby said, can be really, really helpful with all of that. And it takes some work. I actually, kind of like Abby, I use an app to be able to kind of get my sleep back on track because I was having a hard time falling asleep. Those anxiety spirals are not fun where you just kind of like replay things in your brain over and over and over. And I found that the guided meditation apps that get you to visualize something else or bring awareness back to your body with body scanning or body mapping sessions were really helpful to knock me out. It does take some time, it does take some practice, but after a little bit of work on that, I can now throw something on in the middle of the night and knock me out in under 2 minutes. I have nice little bookmarks in my little app. I use Insight Timer, which I recommend a lot to my patients just because a lot of it's free and there's thousands and thousands of tracks for all different things that you can sort out based on background music or no background music and female voices or male voices and length of tracks and all that stuff. So that's been really, really helpful.
Yeah, and what I love about those is something that we've worked on or we work on a lot with our patients is understanding that you can reattend your thoughts. So one problem that many people with chronic dizziness have is they become super hypervigilant to their symptoms. They're constantly thinking about their symptoms and asking themselves, checking in with themselves, how am I feeling right now? How do I feel now? Should I not do this? Can I do this? Is this going to be too much? And I think we used to frame it as distraction can help. And, some people might resonate with that. Well, when I'm distracted, I don't notice my symptoms as much. But if you bring the power back into your hands and think about you do have control over your thoughts, it's not always easy. But if you can reattend your thoughts by some sort of external thing helping you, like a body scan, meditation, or even sometimes I'll tell people to put on a song that they know the words and sing the words of the song. And just that little disruption in that negative feedback loop of ruminating thoughts can make a drastic difference in stopping your symptoms from continuing to accumulate.
Yeah. We have a question, Abby, in the comments, which is very exciting that people are watching. This is from Rich. They want to know, is caffeine a trigger to increase dizziness? And like everything we'll probably talk about is it depends, but it can be a very common trigger for migraine, to trigger migrainous episodes. Not necessarily by itself, but maybe a trigger amplifier. So think about migraine as a threshold disorder where you need to have multiple things that kind of stack up to bring you to that threshold that you have to meet in order to become symptomatic. So, if you didn't sleep well the night before, like as you have a 6-month-old baby like I do, and they're still up drinking a bottle every 2 to 3 hours, and you're stressed out with work, and you didn't sleep really well, and you need coffee to function in the morning, that might compound to create that. On the flip side of things, caffeine can also be a trigger to amplify anxiety. And we do know that when we amplify anxiety, and it can also amplify our symptoms. So it doesn't necessarily have to pertain to just migraine. But if you're a very anxious person to begin with, or you're anxious about your symptoms, which is totally normal and totally something that everybody experiences, especially if you've ever had dizziness. But sometimes adding caffeine to that, depending on how your body deals with it, can increase your dizziness as well, just from that anxiety, unless you are a caffeine dependent migraine patient like me, where if I don't get my caffeine in the morning, I have a full blown migraine by the afternoon. So there's a variety of answers to that question, but I think it's a great question.
Yeah, absolutely. And well answered, because it can go both ways. The bottom line is it can go both ways. It's individualized to the person. We have another question actually from our questions from before, but it also popped up in this chat. And it is to explain what residual dizziness is and what cause of vertigo is it associated with. And one of the things that comes to mind immediately really is BPPV, because BPPV is so common. And we like to think of BPPV as very treatable, which it is, but not everyone, once they get the BPPV resolved, benign paroxysmal positional vertigo, meaning when you change positions, you can experience a usually short stint of vertigo, but not always. You could experience imbalance instead, or disorientation. When we resolve that, a lot of people do feel 100% better. My job here is done. But there is a certain subset of people where they need a little extra. They need a little bit more vestibular based therapy to get their system back acclimated and recalibrated and feel like their normal self again. And in that case, we kind of call that residual dizziness, right? So the vertigo that you experience with the positional changes, or that really intense sensation, is gone, but you have this more vague type of sensation. Maybe it's a little instability. Maybe you just don't feel quite right yet. And that really benefits from a short bout of vestibular therapy, some standard exercises. In general, movement is your friend. When you have dizziness, movement is not the enemy. It is your friend as long as it's done correctly. You're not overwhelming your system.
What I'll say about that too is kind of the mechanism behind some of the residual dizziness is by the time that we see patients, they've been dizzy for a while. It's been kind of a longer term thing. It's been compounding. And what makes sense is that we stop doing the thing that makes us symptomatic, right? So if movement makes us dizzy, we stop moving. But then we're not compensating. We're not keeping that vestibular system strong, especially if we fix something like BPPV, or we start to integrate vestibular exercises. Our vestibular system has now spent all of this time not moving because we've been symptomatic, and we kind of have to play catch up. It got weak, kind of like a muscle. Our vestibular exercises are kind of like the bicep curls for arm strength, right? We have to be able to start moving and introduce a therapeutic dose of movement to recalibrate that system. Sometimes I'll explain to patients too that after we've gone through vertigo and we've replaced those crystals back where they need to go, our inner ear is now confused. It's like, wait a second, we've just been trying to catch up and figure out what's going on here with these things rolling around in there, stimulating inappropriate symptoms and responses. And now they're gone. What do we do now? Your inner ear is kind of like a search engine or a text predictor. The more you use it, the more it can predict what you're going to do and how you're going to feel during that movement. So if we spend a lot of time not moving and then we introduce movement, we have these residual symptoms because we're changing the normalcy of that vestibular system. It's going to feel funky. It's going to feel imbalanced. It's going to feel lightheaded or floaty. You can feel just genuinely worse with movement for a little bit, but we do expect that to get better over time. Again, dosed appropriately, delivered in the right type of therapeutic setting.
Yeah. And another thing I want to mention too is sometimes we see patients for a course of care and they feel much better and they're living their quote unquote normal life again. And then they experience something like an illness later on, or a stressful event, or something that can kind of bring them back into what we call sometimes decompensation, where symptoms exacerbate again. And that's where we have those vestibular tune-ups, where you come in, you adjust your program according to how you're moving at that time, and go about your merry way again. That's very common. We do see some people more than once for that reason.
Mhm. All right. So that kind of leads into another question that we have in the comments. This person has had triple PD, or persistent postural perceptual dizziness, for 5 years, and walking is just awful. It's their kryptonite as the day goes on and it gets worse. And we hear you. That is a feature of triple PD, that it is made worse by motion, which sets it apart from something like another diagnosis that's similar, MDDS or mild Barkman syndrome. And it's tough. It really is, especially when it makes us feel awful. Why the heck would we want to do it? Um, a lot of times we do encourage walking and walking programs for our patients because the more you expose yourself to that, the more you get moving, the better you should feel as long as you're clocking your activity throughout the day. One of the things that I talk to patients about all the time is listen to your body, kind of gauge your day and figure out what it is that you're able to tolerate while still being functional, right? And then kind of backing it up from there just a hair so that you can do a little bit and still be functional and do stuff throughout your day. And as you're able to, as you're having good days, slowly add in more and more, but remain consistent. Consistency is key when it comes to working through some of these symptoms and finding that new normal and that new balance in life.
And I think allowing yourself the flexibility of some grace, like if on Monday you're able to walk to the end of the street and back, and on Tuesday, by the time you're done with work and all your household responsibilities, only to the mailbox and back is feasible for you because you're listening to your body, that is okay. As long as, like Danny said, you are consistent. Again, your brain learns with repetition. So the more you do these things over time, the better. There are some other factors to consider as well, I think, in this case, because sometimes our fatigue and our increased symptoms can come from more than just movement. Are you
Mhm.
hydrated? Have you
Mhm.
eaten today? Sometimes that's my problem. I'm like, oh, why am I getting a migraine? Well, oh, Abby, you haven't taken time to have some lunch today. So stressful events, how is your stress level? Are you managing your stress? Are you taking some breaks? Are you getting up from the screen if you're on the computer all day? Are you
Yeah.
using tools like the 20-20-20 rule, where you look at something about 20 feet away for at least 20 seconds and make sure that something is stable, and you're doing it maybe every 20 minutes. You can adjust the time based on what you need, but there are certain tools that you can utilize so that by the end of the day, hopefully it's not a full-blown crash, crash and burn type of feeling, but you can conserve some of your energy by listening to your body throughout the day.
I love this. Lots of pacing and rest breaks. So it sounds like you're on the right track with that already. Try not to get super frustrated with the slow go of this. This is usually a marathon, not a sprint. I can encourage you to celebrate any small win that pops up along the way because any win is still a win and it's still pushing you in the right direction. It's really easy to get down because maybe we don't see a big change because you experience your symptoms day in and day out. You don't get to see those changes because you're experiencing it constantly. But I'd encourage you to maybe look back to something you did the week before or a month before and see if we're in a better place at all, or compare yourself to where you were in the very beginning and see if there's any improvement there. Celebrate the small wins, be patient, and give yourself grace. Those are huge things that are good foundations to build upon. And then from there, those strategies like Abby talked about, hydration, rest, knowing your body, like everything comes together beautifully, slowly over time. It just takes some practice. It's a lot to completely change a lifestyle and a habit and to stick with it. It really takes a lot of practice and some days where you just go, I can't do this. I need a break. I need a break from all of this. And that's okay. But knowing that you're still pushing in the right direction should give you some comfort, I hope. But lots of pacing, rest breaks, you're all doing the right thing. That's really good.
And another note that I talk a lot with patients about is it likely took your body years to get to this point. And there might have been signs that you ignored or you didn't really pay attention to because they weren't affecting your function to until they got so bad that they affected your function. And you're like, hold on, I better start addressing this and taking care of myself. And the way that that sort of accumulated into something more, something more, something more, the same thing needs to occur on the other end of it. It's not an overnight fix. It will take time to adjust. And another little tip that I like to tell people is, as Danny mentioned, really celebrate the small wins. A lot of people use journaling as a way to get some negative emotion out, which can be fine. But I also love for people to, instead of focusing on the symptoms themselves, write one sentence a day of something that went well or even just okay. And then when you look back at your journal and you see a week full of the small wins or a month full of the small wins, that can be really encouraging in a way for you to, again, see that progress that might not be so evident to you on the day to day.
Reminds me of a patient I literally just had last week. It was only our second visit, and we're kind of getting to the bottom of things. And we've been really consistent with the home program. We started things off. We took our time to figure out where our foundation was, and they came back. I'm like, "Oh, how are you feeling?" It's, which I expect nothing in that first week, right? I could maybe expect somebody to feel a little bit worse, where they're like, "Man, I don't like these exercises," but they came back like, "Oh, I feel about the same. I don't think anything's different." I'm like, "Okay, well, talk about your week. Walk me through it." I'm like, "Well, I was able to bend over and pick something up the other day, and I didn't get dizzy. Oh, and oh, yeah, I haven't had a headache for the last 2 or 3 days now. Like, yeah, it's not too bad." And things started adding up and more and more and more. And all of a sudden, we were like, "Wait a second, this is a lot of improvement in a short amount of time." They're like, "I think you're right." And then they're like, "Oh, yeah, by the way, I was able to double the amount of time on my exercise." I'm like, "Okay, yeah, that's all wins. That's all really good." They're like, "Oh, maybe this is working."
Or even
Um,
able to do the exercise without further exacerbating
yes,
symptoms. That's a
yeah,
huge win.
it was
It's
amazing.
Yeah, and it's funny you say that because I was also working with someone, and at the beginning of sessions, we always ask, we check in with a patient so that we know how to guide our session. And the initial sessions were focusing a lot on symptoms and what the person still wasn't able to do well or as well as they wanted to. And then one day I basically rewrote the script and I said, we're going to start with something positive. Then we're going to add in the things that we want to discuss and work on. And then we're going to end with something positive. And the response was, well, I was able to go to the beach for the first time in over a year. And I was like, what? Where did that come from? You know what I mean? So it's like, we're our own biggest critics always. So sometimes those wins that you don't even clock or register as wins in the moment are some of your biggest breakthroughs.
Hmm. Agreed. We have another good question about visual vertigo. What causes it? And there might be a couple of different answers to this. Abby, I'll start with the concept of having dizziness with busy visual environments. I will say that there are a bunch of people that have different types of vestibular dysfunction that really struggle with those busy visual environments, whether it's big, wide open spaces, going to the grocery store because you've got things moving in your peripheral vision. You have to look around to these busy shelves with all these different colors and things like that. Um, and what I'll say about that is that these vestibular dysfunctions send a lot of error messages to your brain, right? What your inner ear is telling you is different from your vision, which might be different from how your body is reacting. So the difficulty with that is then what does your brain rely on? It becomes overly reliant on visual cues because it can't trust your inner ear anymore. It can't trust your somatosensory system anymore. So seeing is believing, according to your brain, and you become overly reliant on aligning yourself with vertical things around you to keep you upright and vertical and feeling oriented. That's why being in a big crowd might make you feel disoriented. Sometimes you can have that panic attack feeling being out, like at a grocery store, being at the beach, even big, wide open spaces, watching the waves move underneath your feet. If you become overly reliant on visual cues to tell you where you are in space, it's going to be really hard to clock yourself to vertical when there's nothing vertical to associate yourself with. So that's, I think, one definition of visual vertigo and what causes it. It's just that your brain's overly reliant on visual cues. That's why if you've been through vestibular therapy before, you might have done a lot of things to work on eyes closed and moving that head or walking, trying to get your brain to rely more on the vestibular cues and listen to that inner ear more, and decrease the reliance on visual and visual stimuli.
And then also being exposed to some of those more visually stimulating environments, like through video training or busyness in your environment, different patterns, carpets, even sometimes clothing. By the way, I don't know if everyone can hear that. Truck.
We're coming for you, Abby.
um, another thing to think about here is we see visual vertigo or symptoms in visually stimulating environments, and it doesn't have to be dizziness. It could be unsteadiness. It could be nausea. It could be, um, you start to sweat. It could be all sorts of different responses that your body goes through when it's uncomfortable in those situations. But one diagnosis that we see this a lot with is 3PD, persistent postural perceptual dizziness. And 3PD, just to kind of go through some of the diagnostic criteria, it symptoms that present for more than 3 months, so it's considered chronic. Most people have symptoms just about every day and sometimes even majority of the day, although the intensity of symptoms can fluctuate. They feel worse in upright positions, especially when they're up and walking, and then put them in those busy environments, and symptoms further exacerbate. So again, makes sense that a person with 3PD would want to avoid all of that, avoid the movement, avoid the busy places, no more going out to dinner, but that actually works against you in the long run when it comes to recovery.
Yeah, we have somebody who still feels uncomfortable getting out no matter how much exposure they put themselves through. And it's tough. This can be a marathon. It can take a long time. And we're very honest with our patients when we say that you may not be completely back to symptom free, depending on your diagnosis and what's going on, which can sound kind of negative. However, it doesn't mean that quality of life is going to be affected. It doesn't mean that you're not going to get back to a place where you can go back to doing all the things that you love doing. We try to be realistic and not overpromise and under provide what we can do, but there may be a time where you still have symptoms, and finding that new normal is very important for trying to find that quality of life. Keep exposing, keep working at it, stay consistent with everything that's been helping, lean into the things that you find help, and see how things progress over time. Continue to compare yourself to where you are now to where you started, and see if you're still moving in that positive direction. But it is tough. You're not alone. A lot of people still work really hard at this. We have a lot of patients that we've seen over the years that come back for tune-ups, just because maybe we got lackadaisical on some of our exercises because we were feeling really good for a while, or maybe we went back into leaning into some of our triggers because we missed some of our favorite foods. But sometimes we need tune-ups, and sometimes we just need to keep working on things with consistency to see improvement. But it's hard. It's hard.
I think another thing to add to that is when it comes to exposure, what you don't want to happen is push yourself all the way to the limit where you overwhelm your system and create a really negative experience for yourself, and then you don't want to do that again. Or if you do push yourself to do it again, you're already going into it understanding, I remember what happened last time. I felt terrible. I'm probably going to feel terrible again. So when it comes to graded exposure, you really want to create challenging but doable situations where you're gently challenging your system. It might feel a little uncomfortable, but you're working in more of a yellow zone versus getting yourself to that red zone. And then you're repeatedly getting to that yellow zone and then allowing yourself back into the green zone before you push again to the yellow zone. And I tell people sometimes that looks like just making it to the parking lot. Sometimes it's getting to the parking lot and then getting through the front doors. It's getting to the parking lot, through the front doors, and then down a quiet hallway, or a quiet aisle, I mean. And you're building in that regard. And maybe you're just making it to the parking lot for the first 7 days. Maybe that's it. But you stack the positive experiences. So then when you do challenge your system a little bit more, you're able to respond accordingly. You're able to handle it from a psychological standpoint and also from a physical symptom standpoint.
It's never no pain, no gain in this game with us. We never push so hard that you're like, oh, the dizzier I make myself, the better I'm going to feel, or that I'm going to get better faster. That is not the case. If you push that brain too hard or expose yourself to too much too soon for too long, it's not going to like you. It's going to push you backwards, and you're going to feel awful. Making sure that you're dosing all of that appropriately and listening to your body can sometimes be the hardest part in all of this. Sometimes we are really tuned out of our body and what's going on inside of it, even though it's screaming at us to slow down or to change course. So make sure you're listening to that body. That's a really big part of all of this.
Yeah. Another question we have in this chat is it the ear or cervicogenic dizziness, and can you have both? I want to start by saying we have a really awesome podcast that's about to drop on this Not sure of the exact date, but stay tuned because we have Rob Landell on the podcast, and this is his jam, cervicogenic dizziness. The answer is, though, that you can have both inner ear issues and neck issues that can simultaneously contribute to your symptoms. And I think that probably is the case more often than not, that multiple systems are impacting our symptoms. It's not just one isolated thing.
Mhm. I'll say that in the last 10 years I've been practicing, I found this on early on in my career, and this research is coming out supporting this too, but we're seeing a lot of neck issues with dizzy patients. I think mostly because we're guarding. So it is something that I actually work into my in-person visits or in sessions with patients because we'll have done a bunch of stuff that kind of start up symptoms. And I can tell that the quality of head movement is kind of going downhill as we're doing some of our gaze stability stuff. And we tend to end the session with working on that neck and trying to get things to not be so tight and tense. When you're dizzy, you don't want to move that head. I mean, I have so many patients that come in that look like they have like a neck brace on with no neck brace. Um, so working on a lot of the musculature that attached to behind the ear on that mastoid and the back of the head, the very small muscles at the base of your skull where you have that big bump in the back of your head, your suboccipitals, those tend to get very tight and they can actually cause tension-like headaches and ischemic environments that can actually perpetuate migraine activity. So we want to work on those areas, whether it's manual therapy, stretches at home, working on posture is another big thing because postural and actually some of your muscles in your neck have inputs to your vestibular system that help tell you where you are in space. The neck is actually very important. So you can have issues with the inner ear. You can have issues with just the neck. You can have layers of things. The hard part is working with somebody who's able to kind of look through that with you and piece apart those layers and see what's affecting what. But I will say you working on the neck and making sure that you have good posture, flexible muscles, things that are not tight and guarded is really important and really helpful when it comes to vestibular therapy.
And I'm glad you mentioned posture because so much of what we do is here. I mean, even right now, I'm like, oh, my posture, let me straighten
Posture.
up here. Because it does make a huge, huge difference. So throughout the day, sometimes I'll set timers just to do a little posture check with myself because I myself notice if I start to get really forward head and scrunched over my screen while I'm saying, yes, uh, migraine is on its way. And
Mm-hmm.
speaking of migraine, we actually have someone from TikTok and someone from YouTube that both are touching on the same thing. On TikTok, someone said, my dizziness gets worse a week before my period and on my period. And on YouTube, there's a question about does hormonal changes, hold on, I need to read this before I say it.
I think do hormone changes cause maybe dizziness. They have BPPV, they have vestibular migraines, but they started a bioidentical hormone cream that helped the vertigo. Now, this is where like hormones get into crazy town land that it's so different from person to person. I have a lot of patients that start hormone cream going through perimenopause, menopause that will bring on symptoms. I have some people that go on hormone therapy and it alleviates symptoms. The symptoms associated with the changes in hormones around menstrual cycles and pregnancies are very common, especially when it comes to vestibular migraine. A lot of my patients will also wake up with migraines. So they'll wake up in the middle of the night or wake up in the morning, and that's a time where our hormones are changing and peaking the most. So hormones play a very big role in this, especially if you're female. Yeah, it's just so wonderful, Abby. Whether it's early on because you've got these migraines, or later on because you're going through perimenopause or menopause, or we start replacement therapy. Down their pellets are making a really big appearance in treatment and stuff now too, where they have pellets implanted that release hormones slowly. It's a lot and very individualized to every single person about their experience.
I want to actually do a podcast on just hormones and how they can impact vertigo because I
Mhm.
think this is such an important topic. And like Danny said, very individualized. When it comes to changes in hormones, obviously there's things that are outside of our control. This is our biology. However, If you also add in the other lifestyle considerations to help support your body for success, I think that's really important too. Like the things we were talking about before, good sleep hygiene, maintaining hydration, making sure you're nutritionally supported, having a wind down routine, being able to rest without feeling guilt. I think all of these things can help supplement changes in hormones that can negatively impact symptoms.
Ooh, and if you are on birth control and you're still having a lot of symptoms around your menstrual cycle, talk to your OB. A lot of birth control that are estrogen based fuel migraines, especially if they're hormonal in nature. So that's just a quick little tidbit I like to tell patients. And knowing your triggers are also important because those are going to be symptom amplifiers. Yeah, just like, now you bring up a point about your vertigo and migraine starting at perimenopause. Here's what I'll say about that. And I'll tell you this anecdotally. This is just what I see in the clinic. Um, I'll have patients who were traditional migraine patients their entire life. Symptoms came on maybe late teens, early 20s. They kind of cycled around the menstrual cycles, pregnancy changes in hormones, and then their typical migraine symptoms stopped or faded away when they hit perimenopause, menopause. But then what ensued were these episodes of nondescript dizziness. And what we're looking at is a new change in migraine activity. We're not getting the same symptoms that you had as a traditional, what everyone thinks is migraine, like head pain, turn off the lights, go to sleep. But we're still seeing migraine activity and taking on a new form. Migraine activity is just inappropriate neural activity in the brain that creates a physical symptom. And there's actually over 200 different types of symptoms for migraine activity that don't necessarily pertain to the head. You can have abdominal migraines, you can have optic migraines, you can have lots of different symptoms for migraine that don't even involve head pain. So migraine is a condition that's highly genetic. We tend to see this over a lifespan, and it will change in how it presents and your symptoms as your lifespan grows longer and longer. So lots of fun stuff to look forward to exploring and figuring out as time goes on.
Yeah, all really good points. I think it brings me to another point that the more educated you are, the more empowered you are to successfully manage your symptoms. So it's great when you figure out triggers and speak with your provider on how to manage them from a whole person perspective. It's generally speaking not just one thing that does the trick for you. It's multiple things happening at once.
Mm-hmm.
Another question we have, what do you recommend for chronic MDDS patients? MDDS stands for Mal de Débarquement Syndrome. And if I was better speaking in French, I'd have the cool accent. But I don't. But some hallmarks about MDDS, just in case you haven't heard of it. MDDS is a neurological condition, and it's really characterized by people reporting persistent rocking and swaying. And one of the hallmark diagnostic pieces to MDDS is that the symptoms seem to alleviate when the person is in passive motion or motion. Like when they're in a car, for example, they get in the car and they're like, "Ooh, I'm back to normal." They get out of the car, on comes that rocking and swaying. So they usually feel worst when they're just sitting still or lying still. They're not moving at all. They feel best in passive motion. And a lot of people experience this after some sort of traveling event like a cruise or something like that. But they have found that not everyone experiences it post event like that. Sometimes it has more of an insidious onset where there's no cause that we can tell.
There's one thing that we can probably get everybody to relate to, what this probably feels like. If you have been walking or jogging on a treadmill for any length of time and you stop and you step off that treadmill, it's that feeling that you're still moving and going. Now, that dissipates pretty quickly for almost everybody. But for those select few who are on a cruise or on a boat, I had a patient since when I moved to the Hilton Head area. I had a lot of patients that were sitting in boats or relaxing on docks for the day where things were just gently moving. It's an inability for the brain to switch you back to dry land or back to non-movement. They believe it's something that originates in the cerebellum. And you are basically continuing to feel that motion nonstop all the time. And the only thing that takes it away is going back to that motion. So going back on a boat or going back in a car, which can be pretty challenging to try to avoid those things and do everything in your power, exercise wise, to try to habituate those symptoms out, because we need to be in a car, we need to fly, we need to be able to do these things. But it is challenging to manage that solely with just exercise. It's a diagnosis that we just don't have a lot of information on still, which is insane to me, because it's been highly studied by some of the best in the field, and it's still pretty elusive to us. There are some different treatment protocols out there, which vary in success, but nothing that's been the golden ticket yet, unfortunately. But um, learning how to live with the new normal, how to cope with that, working through vestibular therapy, even doing cognitive behavioral therapy. There's a lot that you can do to help minimize and reduce symptoms. And yes, well, can triple PD and MDDS overlap? Symptoms overlap. The problem with a lot of vestibular disorders is that they all overlap. If you're somebody who's been through this for a while and you've been going to doctor to doctor to doctor, I guarantee you probably have 4 or 5 different diagnoses, just out of kind of having those symptoms overlap and having it difficult to diagnose. But what I would say that triple PD and MDDS, I wouldn't say they necessarily coincide together, just because they have 2 very different mechanisms for increasing symptoms. But what I will say is that patients who experience migraine are more likely to develop either triple PD or Malle-Darbarkman syndrome. So somebody with a highly sensitive central nervous system, who's very sensitive to changes in their body and movement, are more likely to have something like triple PD or MDDS happen to them because of that.
So there's
Good
also,
questions.
yeah, there's also such a great website on MDDS. It's mddsfoundation.org. And they have a wonderful, wonderful video on there that I share with people who I suspect might have MDDS, or they've already been diagnosed. And honestly, just feeling like you're not alone and someone speaking your language can do wonders. So I would definitely check out their website. As Danny mentioned, a lot of treatment is still investigative at this point, but I do think that the emotional and psychological support part of it is a major key, and that's really for any sort of diagnosis that causes chronic dizziness. One thing that I find is especially helpful, and we've kind of touched on this, but most people will start to isolate, and they will also remove things from their life that perhaps did 2 things. Maybe they made them a little more symptomatic, but they also brought them joy. And I think it's really, really important to focus on the things that you can still participate in, and especially find those things that you feel good doing in terms of bringing you peace and bringing you joy and bringing you a sense of community and support. I think those are major keys to living a fulfilled life with chronic dizziness.
We had another live question that I think is a really good one that a lot of people really resonate, I think, or have the same sort of a idea in terms of treatment. But this person says, I'm trying not to go the medication route. I had BPPV, which morphed into triple PD and VM, or vestibular migraine. What natural game plans do you recommend to your patients, and what's the success rate of healing? Oh, there are a lot of avenues, which makes me really excited for patients, because honestly, 10 years ago, it was a completely different conversation. This even 5 years ago, this was a completely different conversation. We have a couple of really great podcasts on this with Dr. Shinbei, Dr. Steenerson, where we cover some of this, Dr. Taishio, where there is a potential role for medication depending on your medical history and what you're working with your doctor, especially if things are wildly difficult to manage. But we highly recommend, we really promote going through the lifestyle modifications first, trigger identification, trigger avoidance, vestibular therapy, additional complementary and alternative medicines. But there are new things that are coming out There are different supplement regimens that are being recommended. One of the more common ones would be different types of magnesium and knowing what's right for you and your presentation. And again, this is not medical advice. It's stuff that you can look up on the internet with really great resources, which we can provide some links to. But supplements can be something. Again, things like guided meditation, working on decreasing that central nervous system hyperactivity and excitability. Sleep hygiene is huge. They now have also neuromodulation devices. So this would be something like the Cephaly, which is a trigeminal nerve stimulator that sits on your forehead. Those are seemingly more successful for patients that have head pain with migraine. And then there's vagal nerve stimulation with something like the Gamma Core, or their version that's over the counter is True Vega, where you can use it either as a preventative measure and working on stimulating that vagus nerve to help with that parasympathetic, sympathetic nervous system fight. Or you can use them in active recovery mode, where you might be in the middle of an event or an episode, and you can use that vagus nerve stimulator. There's a bunch of other stuff too that's coming out, including, what I will say, is a shift in medication. We're talking moving away from those daily preventatives like the anti-seizure medication, the SSRIs or the beta blockers, and moving more in towards these CGRP antagonists, which are like your once monthly injections. I think like Venus Williams and Lady Gaga are promoting them, but these are once monthly injections that seem to be less side effect promoting in our migraine population, more tolerated by our patients, and seeing better results over time. We have a really good discussion with that with Dr. Steenerson in that episode, I believe, Abby, where we cover that a little bit more. So, the non-medication route, a lot of lifestyle modification, exercise, complementary alternative approaches to care, those neuromodulation devices. What am I forgetting, Abby? Diet.
Well, I think another big one is a lot of people get lab work done and their providers say, oh, labs are good, no changes. But there's a difference between being in normal range and being in optimal range. And I think that's something important to consider. If you are going the route of getting lab work done, really think about what is optimal versus just, not out of range. So for example, my vitamin D was 32. That was not enough for me to feel well. I had to raise that. Now, while that was still in the range, according to the lab data or range that they said was normal, it was on the very low end. It did not work for me. Other people in the migraine community, a lot of people talk about their ferritin levels. So that might be something to get looked at. And then based on what quote unquote normal is versus maybe ask your neurologist or your provider what would be optimal for me. Is that something that I should consider? And then I think too, understanding how migraine works in terms of thresholds can be really key in your treatment. So Dr. Teixeira in our podcast with him gives this great example of, and I'm paraphrasing, so it's probably a little different, but he basically says, I might have had a great night of sleep on Monday night, a great day at work on Tuesday, and no stress. The kids went to bed fine. I had no issues with my significant other. I ate healthy. I was hydrated. All the things went well. So I was able to enjoy an action-packed movie with a glass of wine. But by the time Friday hits, when I still want to have that action-packed movie with a glass of red wine, I no longer can without crossing my threshold, because guess what? I have had a week of now increased stress. I'm behind in work. My spouse is upset over something, and that makes me anxious. My kids are acting up. All of the things that can layer and accumulate that can lead you to a path of experiencing symptoms. So understanding that your threshold is fluid, it's dynamic, it's not static or unchangeable, I think is really important when it comes to empowering yourself and how to manage your symptoms due to migraine.
Yeah, I think I primarily spend the most time with my migraine patients on just education, and we'll touch base every week, either in the clinic or via telehealth, to review some things, do some exercise and work on the neck, but a lot of it's talking. All right, walk me through what your week looked like. All right, you had a really bad day on Tuesday. what led up to that? What did you do on Monday? What did you do on Tuesday? How did we react to that? Like a lot of it is just trying to figure it out. Sometimes you need a second person to bounce that stuff off of, to be like, oh yeah, that did make a difference, or oh yeah, I did have something funky. So a lot of education, a lot of figuring that out. And I'll be honest, I think that everybody should look at that foundation before you go in and talk to your neurologist or a neurologist. Because one, down here in the South on the East Coast, an appointment with a neurologist will make you wait about 7 months. It's a long time out. And you don't want to wait 7 months to then go into the room and have someone tell you, don't drink caffeine. Here's some meclizine and come back to me in a couple of weeks and let me know how things are going. You want to go in there saying, all right, I know what's going on. I've tried this, that, the other thing. I've got this in place. We saw some improvement, but we're still not moving in the right direction. That'll make your visit significantly more productive and helpful to the provider to guide you what might be best for you. There's a ton of different treatments out there for migraine, and not every single one of them are right for every single person. Everybody's unique. So understanding you, your situation, your symptoms, your triggers, that's going to make it all the easier for the provider to be efficient with you and to help save you time and save you money and copays.
Yeah. You are your greatest advocate. In
Yeah.
today's world, it's you. So definitely read up, study up, listen to our podcast, Talk Dizzy to Me. We have some great episodes on that. I want to touch on a couple other comments on TikTok before we go back to this question over here. And somehow the hour's almost done. But this person is expressing her 3PD makes her feel like her brain is not connected to her body. And she goes on to say, it's not fun to have people look at you like you're crazy when you tell them how you feel. And I just want to touch on the fact that vestibular dysfunction disorders are considered invisible illnesses. So that can have a whole other set of challenges when it comes to healing and recovering and managing symptoms, especially when you're in a world where the term vestibular is not that well known yet. That's part of our mission, is to spread more awareness. And with that, I think we have another podcast episode with a woman who, she kind of made me see a different perspective, because I think I so much have said, advocate for yourself, educate others. This is how you can explain things. But she said, don't explain it, and be okay with not needing to give them an answer. I think just the simple fact of prioritizing what your self-care looks like, and it might change on day to day, can be a really big factor. I also want to mention that we have some good podcast episodes on 3PD from people who are now on the other side of it. And I think hearing those success stories can be really inspiring and motivating, and also just inject that hope back inside you if you're feeling a little bit discouraged.
Mm-hmm. I can't believe we're almost at our hour too. Was there anything else from TikTok?
I don't think so, but I do see a good question here. Can you explain the vestibulo-ocular reflex? And is this also considered visual vertigo? So the vestibulo-ocular reflex is, in order to feel, or what you will feel if you have an issue with your VOR, is typically that your vision is not steady. Your VOR is responsible for something called gaze stabilization. So I'll give you an example that a lot of people will describe. They'll say they move their head and they feel like their vision takes a second to catch up, like it's lagging. Or when they walk, their vision feels like it's bouncing. This can be a sign that the VOR is not working up to par.
The VOR is, I'll get awkward here, look into the camera, but your VOR is your ability for your eyes to stay fixed on a target and have your head move around it, essentially. So your eyes have to move in the equal and opposite direction of your head in order to stay focused on that target. Now, if you've ever been through a bedside vestibular evaluation, you'll have had your head held onto. They'll say, look at my nose as we turn your head back and forth, and you'll have somebody quickly turn your head and sometimes scare you that you're going to break your neck, but we will never break your neck, I promise. But having that quick movement tests that reflex. If there is something wrong with your inner ear and it's not relaying information fast enough because there's a delay, there's a hypofunction, during that test, when your head gets moved quickly, your eyes are going to move with your head and have to snap back and correct. That's that feeling of when you do a quick turn, you do a quick head movement, it feels like it takes a second for your eyes to catch up to your head, because literally that is what's going on by milliseconds. Um, if your VOR is impaired, you can have something called oscillopsia. So it could be difficult for you to focus on things while your body or your head are in motion, especially if you have bilateral loss or loss in your inner ears on both sides. When you're walking, there's a good chance your eyes are kind of bobbling around with your head and they're not able to stay steady, focus on a target in order to give you a clear vision of the world. So having an impaired VOR is definitely going to make you feel funky with quick head movements, especially if there's a lot of motion involved with that. And that's where we do those gaze stability exercises to generate that response, build it back up, and get you back to firing at normal rates again.
Exactly. And just to answer the question about, is this also considered visual vertigo? The two can kind of go hand in hand, because visual vertigo is that symptoms come on in busy places. And a lot of times when you have a VOR that's not working up to par, those busy places can be really problematic.
Mhm. Well, I would say that this was a really successful first YouTube live that we were able to put out there. Abby, what do you think?
I loved it. I think we're going to have to do some more of it. And I just want to highlight that we have a couple really cool things coming down the pipeline. We have a group wellness program that's going to launch this fall. It's an 8-week program. It's packed full of information and evidence-based practices to help you empower yourself to feel better no matter where you are at in your stage of healing. And we also have some wonderful podcast episodes coming up. We have one that we mentioned on cervicogenic dizziness. Oh my gosh, I'm blanking. Oh, we have a really fun one about some vestibular facts and like myths
Yes.
and some fun information that one of our colleagues who we love so much, he's such a great mentor. His name is Dr. Jeff Walter. He tried to stump Danny and I will say he succeeded. I will admit he definitely succeeded. But stay tuned for some upcoming episodes. I think that's such a great place to get free information and get a good start on educating yourself and being able to advocate for
Yeah.
yourself.
If you're here live, thanks for hanging out with us tonight. We feel like we're in good company.
Thank you all.